Good evening, fellow scholars. This evening's conversation topic is about aging and disability. So, aging and disability means a lot of things to a lot of people. Aging or getting old. In my lifespan, which has been very brief on this planet, and the thoughts of other people in which I know, aging or getting old is simply a state of mind. Yes, chronologically, you've circled the sun X amount of times, but what that does is gives you experience, not necessarily makes you old. Yes, chronologically, if we're thinking logically, yes, you are older than somebody else, but are you old in the sense? It's up to you. Disability, a disability to me is something that holds you back. Just because a person or people or group of people might do things differently or have to do things differently doesn't necessarily mean they're disabled. It just means they have another way to do something. The oldest saying is there's more than one way to skin a cat. Just because somebody is a chondroplegic dwarf, yes, technically, medically, they are not like anybody else, but they can still drive a vehicle. They can still, run track. They can do many things. It's until you can't do something that I feel that you're an actually disabled, and you're an actual disabled individual or have a disability when you can't do anything by any means at all. For instance, if you were to have one leg and you needed to have a two-legged jumping contest, you would be disabled because you would need two legs to enter this two-legged jumping contest. So those are my two definitions and classifications of being old and disabled. I have a very old mindset, so someone of an older generation, say my grandfather, he was in his 70s and worked into his 70s with correctional within the correctional system in the state of Louisiana, and while he was an older individual and it might have taken him a little bit of time to do things, he was a spry man and he was on it. And if you asked him if he was old, he goes, "No, boy, I'm not old." So I think age to the older generation is necessarily just a number. As long as you can get out and do what you want to do and do what you need to do, then it's not necessarily a disability or feeling old. But a disability, again, would be something that might to that generation, might slow you down, might or just on out and not allow you to accomplish a goal that you have. Now, while the younger generation, from what I've noticed, this younger generation seems to be very vain. People concerned, oh, I'm turning 30s, or I'm turning 40, I'm the big 4-0, I'm 50, what more am I going to do? I need to go get Botox and look younger. This new generation, they're very set on the chronological of time on this planet as being old, when it's, to me, not the case. And anything that is different than the norm is a disability in this new age. If you look at someone growing up, if someone born with a disability, the parents don't teach their children it's a disability. They teach them a way to accomplish what they need to differently. And still accomplish their goal. They don't ever tell their child they're disabled because that means they can't do something, and they don't want to have that negative mindset. Let's say, as far as if someone in my family needed care for whatever reason, I would have to hire, who would be responsible for providing that care? I would have to hire a caregiver, because in my experience, in my very close in-laws, they had a family member being the care provider. And in my experience, and I'm sure a lot of other people, that family tends to do what is emotionally well for the individual, not necessarily physically well for the individual. Because they'll feed them their favorite food just because it makes them happy, when that might not be what's best for them at the moment in their diet. They'll get things for them when they really need to get up and move around. And family would be somebody who, immediate family, loved ones, brothers, sisters, aunts, sons, things along those lines. typically friends. I know that if I had a family, I've had friends ask me things about their family, if just different advice, and while yes, I know them, I don't think that, or I wouldn't give them information and said, oh well, first coddle to them first and see what you get, make sure they get what they want, but this is what you need to do after that. And it's like no, I was very adamant about this is what they need, and I'm that way with my family. I'm kind of, what they say, heartless about that, but they're still alive, so obviously I can't complain too much. That they need to go and do what needs to be done first versus doing what they want to do. Then how my life has been impacted by aging or disability. So recent activity, I was cycling, and I'm trying to stay healthy, and I flipped my bicycle, and in doing so fractured my right radial head, and I knew something was wrong immediately because my arm started contracting, and I had to get brought back to my truck and then turned to the ER, and that's how we found that out. But when I went to the orthopedic surgeon with this cast on, or soft cast, he's like, so you can't do anything with your right hand, non-weight bearing. We don't want you to lift anything. We need you to no working out, no cycling. It was very difficult for 2 months. For my lifestyle for the past several years has been in the gym at least 3 days a week, first thing in the morning, or on the bike trail or something like that, knocking out 12-20 miles at least 1 day a week. And that really changed my mindset, and kind of send someone, when you're telling somebody they can't do something, it really messes with their head mentally. And so in doing so, that kind of sent me not necessarily to depression, but kind of a down state. When you tell somebody that, I know you enjoy doing this, I know it makes you feel good, but yeah, that's not going to happen for 2 months. And then after that, we're going to do some physical therapy, and you still can't do that for another month. And so now that I'm back in and all healed, and got a nice little battle wound to show from it, starting to get back there physically and emotionally. So that's always nice. And that's how disability has impacted me personally. 3 statistics about disability and aging and care. So I don't know if you're aware of this. So when someone applies for disability, before it is even seen by a medical professional other than the individual's physician, it goes through it's called a disability determination service. There are contractors of the government, and then it goes through a judge, and then while it's in court, this is over months and months and months. At that point in time, it's finally seen by a medical professional, and they're usually the witnesses. But here's a problem: a lot of these people who are applying for a disability, they're up there in age, and so they need this disability income for a way to support themselves, because at this point in time in their life, they're elderly, they don't have that income, and in doing so, we really are doing a disservice as far as their care. They need these funds for for medications, for doctor's appointments, for many things, and that does need to change. As far as aging and the way we look at it, surprisingly enough, the amount of disabled individuals is significantly less than you would think. So, well, I take that back. About 2 in 5 adults over the age of 65 have a disability. Now, with that being said, they're not all disabilities that would necessarily prevent them from, doing everything they want to do. So, a little over 13% of those are serious difficulty walking, or getting stairs, or about 11% of cognitive thought, and then you have about 7% of being able to completely live independently. I mean, they can for the most part get up, move around, do what they need to do, but they need help with some errands. Then you have 6% with hearing issues, 5% with seeing issues, and then there's the smallest number, which is about 4% of people that actually need assistance, getting dressed and bathing themselves and self-care. Now these are out of the 2 and 5 adults. So if you imagine that over a global population, it gets to be a staggering number. While we see this disability in an adult population, we tend to want to coddle. I keep saying coddling, but there's not really a better word, because they look so fragile. Now if you think on the opposite end, we see a 2-year-old child with the same disability, we would do the same thing, but it mentally, on the caregiver's part, it doesn't necessarily hurt them as much emotionally, because that's something we would bathe, we would wash, we would dress a 2-year-old anyway. But when you have a 75-year-old gentleman or female that we're having to do the same thing for whatever reason, it becomes a much more difficult thing. And getting that help is very difficult to acquire if not through the correct channels. So the social needs of how we would help, as a society, help or address it, would realize that just because people want to feel independent, they want to be able, like, they don't need assistance. So I think as a healthcare provider and as a society, instead of treating our disabled or our elderly with kid gloves, the best thing to do would be to do what we need to do in order for those people, aged or disabled, to feel more independent. Again, have that older mindset of, okay, you're not disabled, there's just another way to do things, and we just need to figure out what that is. It may be difficult for the caregiver, family, society, whomever, but it's not going to be near as difficult for them as it would be for the individual who we're trying to help. And they're the ones that do need the assistance, while we can fend for ourselves. They cannot at the moment, and that's what we have to remember. Everything is at the moment. So aging and disabled, it happens. It's just a matter of time.